We will now proceed with the next session for the day, which I would like to introduce Ms. Sonali Behl. Ma'am has completed her bachelor's in applied psychology. She is a Master of Arts in social work, disability studies and action, Master of Arts in clinical psychology, and she's a gold medalist in Master of Philosophy in clinical psychology. At present, ma'am is a clinical psychologist presently working at neuropsychiatric clinic since 2018, and she has a professional experience of working on psychotherapy, specifically behavior, cognitive behavior, and supportive therapy and psychological assessment. We are very happy to have you with us today, and ma'am will be sharing with us on combating stress in the battle with coronary artery disease. Ma'am, you can begin with the session.
Thank you, Rucha. I'll just share my screen. Good afternoon, everyone. I would like to thank Sancheti Healthcare Academy to give me this chance to present how stress can be a major promoting factor in creating heart diseases, and also how we can work on important of making that management and balance of mind and body, as we were listening from Dr. Shetty, and also how we can work together as an individual of bringing change in our day-to-day activities and healthy lifestyle, which can bring better formation of our mindful activities in beating with the stress. So like Dr. Manish has already talked about CAD, so I would not touch into it, but I would like to mention that CAD is something which can be impactful on the mental health of an individual as well. We have most commonly seen the studies which have associated factors which has related to mental health have been seen. Such diseases psychologically can be prolonged with anxiety disorder, depression, PTSD, and chronic stress. And lately, when post-COVID scenario has arisen, we have also seen people coming up a lot with health anxiety issues, where they're generating concerns about the fact that they're going to lead to any kind of a severe illness, and most prominent is a heart disease, probably because they are suspecting reading on the internet or reading Google as a source of their knowledge to protect themselves from understanding how differently things are happening around, and that leads to a lot of stress and depressive thoughts in an individual, which can actually lead to a lot of psychological illness. So what is exactly stress? So stress is a physical and emotional reaction that people experience as they encounter changes in life. To a regular lifestyle routine, stress can be normal. A normal stress can be seen with facing an interview. When you go for an interview, you interact with new people, you have some reasons of presenting yourself, you find it difficult to be okay in presenting yourself, your body image issues can also lead to a stress factor. But a stress which has a long term progress or a chronic stress can contribute to worsen a range of health problems such as digestive disorders, headache, and sleep problems. So, which common symptoms which can be seen while leading to stress are mood change, sweaty palms, dizziness, trembling, and muscle tension. So, you can also see that chronic stress can impact a heart disease. It can increase your weight. It can also lead to sexual dysfunction. It can also lead to hair loss. And these are some of the complaints with usually the clients come up with. Now, regarding the relationship between CAD and stress, the body's response to stress is supposed to protect you, but if it's in a higher range, it can lead to a constant harm to your body. The cortisol hormone, which has been released in response to stress, which actually Dr. Nagarwala also presented about, is something which suggests that high studies have shown that high level of cortisol can lead to a long-term stress. It increases your blood cholesterol level, blood sugar level, and blood pressure. These are some common risk factors for the heart disease. The stress can also cause changes that promote buildup of plaque deposits in the arteries. These are some of the stress hormone. Cortisol leads to nerve problem, heart problem, decreased attention and memory, which we usually see with the patients coming to the clinic, weakened immune system, digestive problems, high blood pressure, increased anxiety and depression. Some of the factors which you can see on the screen are also seen with the people coming up with a higher level of stress. And we always recommend that people with different mental illnesses also have a combined feeling of these stress hormone release factors, which can actually impact their well being and also impact their functioning to a larger level. So we would now see that there is a vicious cycle between how the heart disease and stress plays a role. So for us, how to manage the stress, we'll be talking about some mechanisms in a later stage. There is also statistical evidence which has shown throughout the different studies that a study which was conducted with Asian Cardiovascular Thoracic Annals, the study showed that there are levels of patients aged between 35 years or older have been diagnosed with CAD and are undergoing the bypass surgery after that. There are also studies which show that psychological stress and CAD with moderate level of day-to-day stress being prime contributor to leading the evidence of stress and relationship between CAD. The body response of lifelong stress and sudden life events was found to have a substantial effect on the provocation, progression, and prognosis of CAD. As all our eminent speakers have also talked about the level of stress in different age group also. This is a generic study between which 60 patients have been taken up. So there are high level of stresses which is on a higher range and moderate level also, which both can combine to leading to a higher level of difficulty and leading to heart disease. Now, talking about the ways, first is exercise, which everybody has been talking today on the day. So, it actually has a very important role because exercise is something which actually releases your happy hormones, which plays a very vital role in bringing a better well being and mental health for you as well as the people around you. So your behavior, your exercise can lead to a very good mindful well-being activities you can do throughout the day and can increase your attention, motivation, your level of concentration, and a lot of activities which can help you for saving yourself from the stress which we feel in day-to-day basis. From moving your body on a regular basis can balance the nervous system and increases the blood circulation. It helps to flush out the stress hormone. Exercise does not always have to be going to a gym. It can also be running, playing sports, or even a 20-minute walk can make a difference. So, as everybody has been talking about the minimum time limit, if a person is already having a psychological stress, a person is going through a stress factor involved in their daily life routine, we suggest a minimum 20 to 45 minutes of walk to them so that they can at least manage their weight and a healthy routine to balance their weight in a regular diet. So, exercise can also include not just gym, but also something like yoga or breathing exercise, which usually helps you to release your stress and also get more focused. Now, Dr. Nidhi also talked about this eating healthy diet, and every other eminent speaker has also talked about the nutritious values which is required for us to balance our mind and body together to lead in a healthy routine and diet. So that's how we have talked about it. I would also like to talk about one thing here is about mindful eating, which is really a better scope for us to deal in a better form of paying attention to a food on purpose by movement without a judgment, which helps an individual to focus and be aware about the sensual awareness of your own body. It helps us in improving your concentration, your need for the food, the chewing would be better. You will be more focused and less diverted from your phone or the TV you're watching while eating food, which is highly not recommended, but people do so. And it also helps in obviously making you feel more full and not feeling less hungry or more hungry. It would make a more balanced, productive approach for you to have a healthy eating. Now, avoid alcohol, which is also being talked about, but it is also being seen that it has how Dr. Nagarwala also told that a minimum amount is suggested, but also a low over or increased amount of it can actually impact you and impact to lead to a stress in a longer term. So, as we talked about sleep in the earlier sessions, sleep is also something which is very important role. And post COVID, most of us have held and led to a many excessive usage of screen or getting into our phones, late night conversations, or too much occupied during the day, and then leading to not getting a good sleep at night. And then we are not, most of us are working from home, so we are not even actually running around every day, so we prefer to go sleep at late nights and get up at late night, which is not a healthy diet or routine which can make you feel better, but it also leads to a stress level. So in psychological aspect, if I talk about, sleep is something which is giving you to have a tolerance in improved balance about coping with the stress you're going through. It gives a good sleep can lead for a better thought process. It will reduce your negative thought pattern. It will also help you to have a more productive and a maintained concentration throughout the day. It also has to be addressed if it is less amount of sleep during the day. You can definitely, if you're having a routine where you're not spending much time in your daytime, you're already occupied with something, you should have a good sleep. And also the time of your work, if it is late night or you're having a night shift, can also impact your sleep, as well as can lead to a level of stress which can later lead to a lot of anxiety and depressive episodes, which usually patients come with, as I have seen them over the last 5 years. And also it is very important to have a good relaxation technique to use before going to a sleep. And there are some sleep hygiene points which plays a very important role before going to bed, such as not getting involved into reading, not getting into your electronic media, avoid taking any electronic media to the bed, switch off your TV light, and put a soothing music so that you can have a good sleep, or a relaxed music, which usually people use of instrumental music to use and induce sleep on a regular routine. There are also some JPMR techniques or relaxation techniques or sleep hygiene techniques which helps you to undergo a good sleep if you're finding it difficult to get a sleep. Now, this is one thing which all of us need, because definitely after COVID, most of us have stopped going out and there is a limited interaction and travel limitations. But it also has a very important role in managing the stress, which everybody at present has been going around, because that helps us to have a refreshed mind. It helps us to look more emotionally better outlook about the situations. It makes us more happier and more productive. So we can also think about avoiding using electronic devices when we are on a vacation. And this can lead for a better stress management technique for us. And spending time with family members is something which everybody would enjoy going out with. Now, try being social. Now we have seen that post COVID, everything has been something which has been used through social media or electronic media, and less of in person sessions or meeting up people or going out somebody's place. So for increased that perspective, this has been study has been shown that stressed people who have adequate level of social support, they receive an oxytocin boost, which helps them feel less anxious, more confident in their ability to cope, and more drawn to other people. This can actually perpetuate the positive cycle of social support. And I would also want to say that with the present scenario, excess use or even social media's excess use can lead to a very difficult situation, which actually leads to a lot of psychological stress and difficulty with the mental well-being, specifically with the youth per se, which has been proven and shown post COVID activities. There are an excessive amount of researches which have taken place and shown the disturbance of thought pattern also has led to a lot of anxiety and social anxiety issues among the youth. So try social being means you have to interact with somebody in person, find out time and space from your routine to go out with your friends, go out with the closed ones you enjoy talking to, and have a healthy conversation. Make time for your hobbies and passion. It is something which most of us, with the regular routine of excessively involved in our own success rage or rat race, which we do every day, of running from one place to another, going to clinic, having patients, seeing people, and not giving time for ourselves, can also impact our stress levels and not make us feel healthier inside and out. So, practicing a hobby brings us a sense of fun and freedom to life that can help to minimize the impact of chronic stress. Those who feel overwhelmed in job can, for example, benefit from hobbies because they provide an outlet for stress and something to look forward after a hard day. So people can actually indulge in singing, they can involve themselves in dancing, they can learn something new, art-based techniques to evolve themselves. They can try reading or even learning some new musical instrument can help them feel more relaxed and better to cope with their stress levels or a hard day. Now, coming to a rebalance work and personal life. Are we all having work and not paying much attention to the personal life? If you're spending too much time at office, intentionally put more dates in your calendar to enjoy time for fun and either alone or with others. Now, quit smoking and chewing tobacco, which also leads to a lot of heart diseases. It's a popular and a reduced factor known as to be leading to a heart disease. And when we see that it gives the nicotine has an immediate impact, which gives a relaxation, if which is temporary, but in a later time, it will give you an increased craving and withdrawal symptoms, which impacts your well-being as well and also leads to a lot of stress and pressure. So people with who are smoking have been involved more to cope with their instant level of stress, but it is just a temporary relief. Like anxiety also is a temporary relief for us to cope. People have seen that anxiety and having smoking addiction is very common. The studies have been shown like that. The anxiety actually is something also which works in a vicious cycle with the situation and the stress level, but nicotine works for people very less, and then that is just for a temporary solution but not a long term solution. So we won't suggest anybody to have a smoking habit if you have any kind of a stress or mental illness. Set a routine and a practice time management. As we all know, time management helps us to reduce the long term stress and giving you a direction when you have too much work to do. So, like we have been talking about the multitasking approach of men and women in today's world, we definitely need to have a better behavior and outlook of maintaining a routine and a time management technique. We should obviously don't need to overburden ourselves, which might impact our emotional and physical well-being as an overall thing. So we would request you to have a routine which is healthier, balanced, and also making each of us involved in something which makes us feel happier. So it puts you in control if of where you were going and helps you to increase your productivity if we have a better time management. Now, this is one thing as a professional, I would say that most of us need to go out and seek for help if it is really a need for us to talk about what we are going through, how we are feeling, what are our thoughts. Some things might be troubling you, and it is nothing like if you have been diagnosed or you are having a symptom of any psychological illness or a distress is the only need for you to go and consult a therapist or a counselor. It is suggestive that you can also go and meet a counselor if you are finding yourself to be blocked, confused, or finding difficult to even get a normal sleep or managing your routine. Sometimes we are so much overburdened emotionally that we are unable to identify that is impacting our routine and increasing the stress level and increasing our chances to lead to a lot of physical illnesses such as heart disease. So sometimes, how much ever you try, your negative thoughts overwhelm your ability to make positive changes. If you believe stress is hindering your day-to-day activities, then do seek help from a professional and talk about your feelings. So I would like to put a takeaway thought here by ending up my presentation with this thought by Albert Einstein, which says, a calm and a modest life be- being more happiness than the pursuit of success combined with constant restlessness. So, if you have a more calm and modest outlook towards the life, which brings more happiness of success, is better than having a constant restlessness. So, your well being matters more if you are on a stable and a calm outlook, in a balanced routine, and even a well being per se, which can lead to a healthier feeling of being your own self. Thank you so much.
Thank you so much. Thank you for this informative talk, ma'am. We deal with a lot of patients who have anxiety and stress when it comes to cardiac disease, and there are a lot of questions related to it. But your talk was definitely helpful. Most of our viewers are actually from the student category. So many things that you mentioned, I kind of related to, because you spoke about relaxation that we learn, as a part of physiotherapy curriculum, and exercise prescription, no doubt, for stress management. But also, I like this point about involving relatives or family in the treatment, which I feel is very, very important, physiotherapy point of view as well. So thank you once again for joining us today. And
Thank you so much, Richa.
you're welcome.